like SI joint pain, like right here on this right side, and starting up now, and it usually just gets worse from here on out.
Yep.
Sometimes the pain shoots down, other times it stays isolated like right there.
You don't mind me talking about your health information. So, 17 weeks pregnant, right? Abdomen's you're starting to show a little bit. Belly's starting to come forward, right? Whenever the abdomen comes out away from the spine, it pulls the spine with it. So as that spine drops forward, it creates this hyperlordosis, this curve increases, which then takes your sacrum, which is attached to this, and dumps it forward. This joint where this ilium here and the sacrum meet, it moves like this. You see what I mean? Well, this is dumped forward, right? This is getting pulled forward from your hip flexor. So when you go to walk, it's not moving right. You're moving with dysfunction, and that's every time is going to be an injury. And then your body's telling you, hey, that don't feel right. For you to feel pain, right, that means it's significant, right? So we're not going to play around with it. We dig here on the sides, on all those external rotators, and we dig all the way to the front of your hip flexor here. Lower cross syndrome is what you're dealing with. This hip flexor here in the front is so tight, it's taking this whole ilium and it's pulling it forward, straining the ligaments that hold everything back here, making you feel pain here. So everybody wants to treat here, right? But the treatment really needs to be up here on the front. You see how tight that is? And that feels good, doesn't it? Now breathe and squeeze the right muscle, which is your Kegel. And yes, now let go. Let go. When you did it and you fired this, you fired your hip flexor too. I don't want both of those flexing. I want you isolating this and separating it from your hip flexor. Breathe in your belly. Lightly squeeze. Nope, you failed. Let go. Can you feel my hip flex? You feel your hip flexor? I do not want this firing. Your brain needs to know the difference between this and this. So go less. Breathe. Less. Yes. See the difference?
Yeah.
So you and I are a lot alike. We're very intense. We don't do anything half-ass. This is very important that you find that little finesse with that muscle squeeze. Breathe. Easy, tiny. Yes. That was probably even still a little too hard. How's it feel?
Better.
Good. How my pressure?
Good.
Good. Now breathe in your belly and let it all go. Good. See, once your hips start to loosen up, everything starts to loosen up. So breathe. Very tiny. Have the finesse of your Kegel and your butt squeeze. And then let it go with your breath. Good. Breathe in your belly. All the way out. Wow, that was so good. Breathe low. Loosen. I love relaxin'. That chemical that gets secreted when you're pregnant to make everything adjust. It's both good and bad. It's bad because it's pulling everything out. That's why you got to be really solidified in those ideas of breathing and Kegeling and gluting, but not too hard again. Breathe and let go. Loosen. So good. Look your head up. Let your chin rest on the table and breathe and let go. So good. Drop your head down. Breathe low in your belly and let it go. Loose. Breathe. All out. Loosen. Getting there. Hold on to the arm rails. There we go. Breathe and squeeze, and we'll get up and I'll get this cushion out from underneath you. Slide down. You're kicking butt. You need to hear it. You need to hear it. You're kicking butt.
Thanks.
Breathe.
I don't feel like it.
That's all right. Let go. Sorry I put pressure on, baby. You okay with that? Breathe and squeeze and turn to me. Straighten on the bottom. Breathe. All out. Lean. You cool with that?
Yeah.
I had to do a little harder than I wanted to, but
Okay.
if I didn't, it's not moving.
Yeah.
You're just kind of that post-holiday stiffness, you know? Yep, all the way over. Perfect. Pull in this arm. Hold here. Straighten. Bend. Good. Breathe low. All the way out. Yep. You okay with that pressure?
Yeah.
Stay on your back. I'm going to pull you to center. Bend your knees. And cross our arms. Breathe in your belly. And let go. Loosen. Now, because that hip keeps wanting to go out, right?
Yeah.
I want you to be able to lift your leg and get into your car and not pull it back
I
out.
know.
So we're going to go to the hip flexor. You mind me touching?
Uh-huh.
We loosen this part up.
Okay.
Right? I typically do it before I adjust your hips, right?
Uh-huh.
I'm not trying to do a whole lot of pressure and stress on that.
Yeah.
5, 4, 3, 2, 1. That feels good?
Yeah, I
Good.
mean tight,
But you feel it though, right?
Yeah.
You feel how that's the culprit,
that
correct?
is, yeah,
So when you're
tight.
sitting, you have to breathe and you have to Kegel and glute. Not too hard to where that fires too, just enough to where you feel it underneath you and not in your hip flexor in the front.
Well, no, it's just that side. I mean, this side feels totally tight.
You probably sleep with your leg really everted out like this. You could be doing something during your day where you're rotating your feet out on that side.
Yeah.
That's the most common thing we see.
Okay. Like just like
They're doing
symmetry.
this sense. This is
Yeah.
bad. This is good.
Yeah.
They'll walk with their feet out. They'll sit with their feet out or crossed underneath them.
Uh-huh.
Those are all going to cause it. On your
Okay.
side, face me. Yep. All the way. Yep. Straighten on the bottom. Bend on the top. Right? You're going to gain 2/3 more of your blood, right?
Yeah.
You're going to have a ton of inflammation on you on purpose. For pregnant moms to feel well, it's to me, that's, tell me how, you
Yeah,
know?
I
It's
know.
incredible what you go through. Breathe and lift your knee and let go.
Oh, okay.
I love that.
That like went all the way up.
All the way up on your back. Making me look good. That was great. And then bend your knees. Right? But if I wouldn't have loosened up your hip flexor a little bit and I would have tried that, it wouldn't have moved as well.
Yeah.
Because that tight quad all the way to your hip flexor is restricting it from going back the other way.
Yeah.
This is the most common injury that I see in all of my low back pain patients. Not just pregnancy, but all of them. Sit on your hands for me. Can I take this? And relax. And slide back to me a little. I'm perfect there. Now, because you're pregnant, right, and you're holding on to 2/3 more blood, you have an artery that runs through your neck called the vertebral basilar artery, okay? If you've ever heard of a chiropractor hurting somebody, right, they were way too aggressive on the neck and they damaged that artery. Being pregnant, you definitely don't want anyone being aggressive on a cervical spine adjustment on your neck, ever.
Okay. Just because I have increased blood?
You have increased blood pressure in your whole vascular system. You're carrying so much more now than what you're typical used to.
Yeah.
And you can imagine what happens to the system, the arterial system. Of course, the risk is super low, but we're not in the business of hurting people. It's more important for everyone else to know in the world that we got to be careful on the neck. Very easy. It's just a tiny movement from here to there. See what I mean? And because you have so much relaxing, it'll still adjust. There's no need to be aggressive on the neck. If you loosen it up and you do the stretches and you take the time, you'll even have more relief. Fall. Thank you. I'll take your hands. Breathe and squeeze. Come on up. Good stuff.